today, what I want to bring up lately, I've been getting lots of requests and consults and questions about men and how they manage or have difficulty managing continence, especially peeing, urine. So, yeah, I know it's early in the morning, and some of you are like, oh, really? Yeah, really. Because it happens at various points during the day, and morning is one of those times it typically happens, and then it happens at other points as well. On average, people are going to go to the bathroom at least 6 times a day, and often more, particularly if they have any other conditions, or they take certain medications, or they take in adequate hydration, or for a lot of reasons. Here's the thing. So I want to bring up what I have been really talking with people about a good bit lately, which is the state in which men are aware they need to go. They do know that they have to go, but they don't have a lot of lead time. So they have just enough time to recognize, oh, I've got to go, I've got to pee. And so what they'll do is often get up, they stand up, and then they find a place to relieve themselves. I mean, which is making sense. Now, the challenge is that's occurring in places where it typically would not happen. Living rooms, bedrooms, closets, corners, doorways, down the end of a hallway, against the wall. So that's what's happening. And folks have tried a couple of things and haven't found it particularly successful. So they've tried something which is more for sort of trying to promote. So there's two ways of going about this: promoting continence or managing incontinence. So when we talk about promoting continence, what we're talking about is helping the person stay dry. In continence, we tend to think of putting the elimination, pee, in the right place at the right time. So we get rid of it, but we don't just get rid of it. We put it in an acceptable place. A toilet, a urinal, a container of some sort. That's just what we do with it. Now, managing incontinence means the person is not able to manage their urine in this case, or it could be bowel, but it's urine in this case. And so what we do is we manage it when it comes out of the body. So what we're saying classically with males, males are built different than females, if you didn't know that. So the male anatomy allows for the penis, and the urine comes out the end of it. So what we've done is we take things like, they're called Texas catheters kinds of things, or we take a catheter which often has adhesive on it, or it doesn't, but it has an adhesive strip that you put around the top. You roll it up and then you hook it into a bag that catches the urine. Okay. And so there's a catheter. So it's like a plastic sheath that you put over, so like a condom, but not exactly. And then what you have at the end is an outflow, and then you have a plastic thing and a tubing that goes down to either a leg bag or some sort of bag. And so the urine only actually touches the tip of the penis and then drains down into the leg bag. The leg bag is held on with straps, classically. So this is sort of the first state of managed incontinence, where the problem is not the bladder holds on to it or the prostate blocks it, but the urine come out, but the person doesn't go where they're supposed to go. And so the old strategy was put Texas condom catheters on them. And so what would happen is people would wear condom catheters, which meant we were actually manage their incontinence. Okay. Well, for people living with dementia, what do you guys think about that? How is that going to work? Okay. If they're really not aware of the need to pee until it happens, like it really is coming out, how would having a condom catheter on and a bag on your leg, what do you think? What do you think the percent of folks are that are going to be comfortable with that, okay with that, won't be bothered by that, or accepting that because, oh yeah, that's right, I can't manage my incontinence, I can't manage my pee, so I just wear this thing, and then every now and then it has to be empty, and this is how you empty it. And then after a day, we take that one off and we detach it and we clean off my penis, and then I'm fine, I'm good to go. So Matthew, have you, this is just a curiosity, and you can say, Teepa, none of your business. Have you ever worn a condom catheter?
Actually, I have not.
Oh, okay. And I'm wondering how many healthcare providers, I mean, I can't wear one. I can do a female catheter, which is very weird. It's not really at all the same because we're built very differently. But for males, if you're a male and you're a carer, I would suggest you try on a condom catheter because, you know, it's really not that comfortable, way, shape, or form. Let alone when you have the sticky stuff, guess what it gets stuck to? Ouch. It's very easy for it to get stuck to pubic hairs. And I will also tell you, you have to really be willing to let somebody mess with your penis when you're not needing to pee. I mean, so the whole thing is pretty intense, let alone the weight of the urine in the leg bag, and the bag hanging on your leg is an unfamiliar sensation. And so although it can work for some folks, it works more for people who have sensory loss, stroke, that kind of thing. And you know, they get that they can't hand on to their urine. And so it's actually a way to manage urine where you don't have to get changed. You know, you can manage this incontinence. So I've certainly used it in rehab a good bit. But so next thing, we move into something that is more like a female thing, which is incontinence pads. So we manage it. Now it might be a small container, and you know, we have one provider that we've worked with a good bit and that we really like, Sensi, and they have one that's actually shaped to up around the penis and sort of catch a lot of urine. But okay, so that's once people are not able to manage the urine at all. So there's this in-between time. Okay, and it's really this transition from promoting continence to managing incontinence. So what we have is we have a male who recognizes, ooh, I've got to go. Now, where does that come from? Well, it comes from the nerves that are located stretching around the bladder. And when your bladder starts to, when it fills to a certain level, the nerves get stretched to such a point as they go, ooh, ooh, this thing needs to be empty. Now, when the bladder stretches that much, the muscles of the bladder get a signal. And at childhood, this actually goes through what's called a spinal arc. So really low on your spine, you have this arc where when the bladder fills and the nerve reacts, then a message gets sent to two sets of muscles. One is the bladder muscle, and the other is the tiny little sphincter muscle at the bottom of the bladder. And the little sphincter muscle gets a message, relax, I need you to open. And the bladder muscles squeeze so that we can force the urine out through the tract, out the penis to wherever you want it to go. So this is the place in condition where what actually happens is the brain sends the message, or the bladder sends the message to the spine. And at the same time, what we've learned to do from the age of 2 to 5 is a message goes up to your sensory motor system. The sensory motor system registers, ooh, urination is about to happen. And a message gets sent to the prefrontal cortex and the hippocampal area to say, ooh, urination is about to happen. And the prefrontal cortex says, ooh, whoa, impulse control, pause. Hippocampal area, is this the right place to do that? And the hippocampus replies, no, you're in the living room. Oh, okay. The message shoots back to the sensory motor system, says, whoa, don't go here, but get yourself together, get up and make it to the place you're supposed to pee. Go to the bathroom, find a bathroom. And so what happens is the message goes down and it says, muscles of the bladder do not squeeze. Little tiny sphincter, hold on until we get to where we're going. Now, at this point in time, the person still has the sensory motor skills of their hands to unzip, bring their penis out and pee. That part's working because that's That's sort of an automatic pattern. So what do you think, Matthew, might be going on here then? What's happening to the brain and the spinal cord reflex and the bladder and where the person is when we have damage in the hippocampus, we have damage in the prefrontal cortex, and we have damage in the sensory motor awareness system of how quickly and early the message gets picked up. So we should have noticed what? That my bladder was sort of getting full. And so, you know what? I'm just going to go ahead and empty my bladder before it gets really full, because if I let it get really full, then you know what will happen, which is again back to the prefrontal. So what do you think here? What do you think might be going on?
Yeah. So in those situations with the damage in those particular areas, that's why we start seeing not not going in the right place, or not
Yeah.
going at the right when they need to, or being sudden urgency, or just happening. So not that normal habit that we all take for granted,
Yeah.
but we do, like you were saying.
Yeah, because in that moment, going to find a place. Now, what might you find? What was some of the things that you learned early on as a little kid? So if you can't get to a room or something and you see a tree or you're outside, is it okay to pee outside?
Well, yeah, as a kid, go ahead. Yeah, you were told to go pee by a tree if you had to
Go
go.
pee by a tree, better than wetting all over yourself. Or if you can't hold it, I mean, if you can't hold it, you can't hold it, and better that you control it than that you can't hold it, because the goal was that you learn to control it, and then you can control it for longer and longer. So here's the tricky part. If you, if I took you to the bathroom early, let's say 5 minutes, 10 minutes before that reflex kicked in, what would happen when I had you, and I'm going to give you two examples, sit on the pot? What do you think would happen for you? If you had damage in those areas, what do you think might happen?
I, I, I at that point, I probably wouldn't think that that's what I needed to do, and I would just,
What might you do sitting on the pot as a male?
well, usually having a bowel movement if I'm sitting on a pot,
Or farting,
or oh yeah, passing gas, yeah, yeah.
passing gas, and then what?
Then that's it. I'd get up and
That's
go.
it, you're done.
Yeah.
Because guys, one of our habit structures in the US is we teach men to stand to pee. We teach kids to stand, male children to stand to pee. We teach children to sit on the pot when you have to poop if you're a guy, but you don't stand to poop, you sit to poop and you stand to pee. And so that whole thing that we have really established this, and it's really good to get pants out of the way when you're going to pee, because we don't want you getting them wet. You need to move them out of the way, but we put little zippers and little openings so that, and you can even pull your pants down some so you can, just pull your penis out to do this, and you use your hand to do that. So what happens if somebody yells at you when you're in the middle of peeing, do you think?
I would stop.
You would be, oh, geez. And now you're holding urine. But here's that tricky thing. So here's the problem. If I put you on the toilet ahead of time, even if I stand you in front of a toilet ahead of time, what was actually triggering your brain to pee? Was it your brain that was getting a message?
Well, what would trigger me if I was standing right in front of the toilet would be the visual of the toilet itself.
Okay. So, but what if you weren't quite to the place where your nerves were stretched?
Then I wouldn't. I probably wouldn't think that's what I needed to do. I'd just be like,
yeah.
Okay.
I mean, would it take actually thought to say, even though I don't have to pee right now, what I should do is pee right now, because then I don't have to worry about it later?
Yeah, I would probably look at that and be like, I don't, why am I here? Well, I don't need this. And
How about why don't you try to pee, Matthew?
try here.
What's your first thought? What do you think your first thought? Why don't you try to pee, Matthew? What do you think Matthew would say if he hadn't gotten a strong message?
I don't need to pee.
I don't need to go right now. Well, how about you try?
No.
What part of I don't need to go right now did you not understand? And so If he doesn't, one of the things he might not even want to do is pull his pants down. He might not want to uncover himself because I don't need to go. When do you uncover yourself? When you need to go. So now we have a situation where men might be peeing in places where we wouldn't want them peeing. We wouldn't normally see them peeing. And historically, one of the things that has been said is, well, we've got to preserve their dignity. And I really asked the question, well, is it really preserving their dignity, or is it us being comfortable with what they're doing? And we're not comfortable with what they're doing. And so we don't want them to do it. So maybe what we need to think about is, how could we accept that the brain failure is at this place? And what could we do to modify the environment or the timing or the support of people around to better figure this out, rather than try to get the person to change how they do what they're doing? Now, a couple of possibilities would be, as Matthew starts to get up, and I know it's about that time, I go, oh, hey, Matthew, could you come down this way with me for just a second? I want to show you something.
Go with you?
Yeah, for just a second.
Okay.
And if he says, okay, what I want to do is take him immediately, because I know I have a very short window. Now, notice that my goal was not to get him upset. It was just to see if I could get him for just a second. And I'm actually trying to trick his brain into paying attention and not doing this automatic next movement, trying to promote his continence. And I'm going to take him to a little setup of some sort. Now, am I going to get him all the way to the bathroom? Absolutely not. Am I going to get him all the way to his room? No. Am I going to get him to totally leave the area? No. Do I have to figure out how I'm going to do this? Yes. So here's my question, ultimately. How many of you out there have had a situation similar to this? Because I've been asked a lot about, so what shall we do? And some of the things that people had sort of thought about or tried or don't want to try, but people are bringing up, are things like Q2-hour toileting, wearing a onesie, which is something that zips up the back and doesn't give people access from the front. Doing things like taking the person, trying to get the person to go with you after they've started, getting the person or making them try to stop, trying to put your hands and not do that, put a brief on them so that they can't, trying to figure out how they can't get to their penis and get it out. So I'm curious how many of you have encountered this issue, because I truly believe this needs a care plan with options on it that do preserve someone's dignity, do keep them being somewhat continent, but recognize, just like children first learning to manage this reflex, what we're trying to do is sustain a reflex as long as we can, so that the person doesn't have to wet themselves, doesn't have to be changed, doesn't have to be manhandled, but we do acknowledge the hippocampal damage of wayfinding and recognizing situation and place. And we protect the others in the environment. I get that there are other people in the environment that don't want to see this and don't want to smell this stuff, and we don't want to damage the environment. What can we try? And let's get some care plan options that are realistic and are real, because, what I'm hearing often that people have down as options simply doesn't make a lot of sense, given what my familiarity with progression of dementia and different types of dementia, and the idea of let's add in frontal temporal, or let's add in sensory changes that may be part of a stroke or vascular dementia, or even with Alzheimer's or late, or some of the other conditions, and the hypersensitivity to touch and being handled, and that part of the body being hypersensitive. So we're asking for some help. So the two questions, and Matthew put them in there, and we're hopefully going to get some feedback, is, have you ever had this situation? We want to know how common it is, because My experience, it's a common thing. And then are you willing to give us some more information? Can we gather some more information about things that you tried, things that haven't worked, things that have worked, things that cause trouble, things that in fact seem to be more problematic than they are helpful? Give us, we're looking for more data, more information. And yes, we know it's quote unquote anecdotal, but if we don't start gathering stuff that makes sense, I don't know how we change something. So Matthew, what have you got on your side of the street out there?
Yeah, so we definitely had some folks share out some of the things that you mentioned, Teepa, like with the every 2 hours, the Q2, taking someone to the restroom, and one of our viewers actually was sharing with us that her husband does have one of those suits that zip up in the back, and we were kind of talking a little more about that, and that they did that because he was going in inappropriate places. And on top of that, that he doesn't really notice that it's there. He doesn't mention that it's there, but obviously staff have to help him with getting that off when he does go, and how it's hard for her to see that, see him, because it doesn't look normal. It doesn't.
Yeah, and now we're managing his incontinence rather than promoting his. We're managing his incontinence, not promoting continence for him. And he had some abilities, but now he's being told don't use those. And it's like we're taking away some of his abilities because of our inability to figure out some options that would allow him to still use some of the skill sets he had. And we're struggling with how to manage this. And our idea of, well, take him every 2 hours is like, there are going to be times I simply can't believe that's going to be an appropriate response because of where the brain is and what the physiology of urination is and what the reality of dementia is and care staff and what is going to then happen to relationships. So I want to dig in because I can't leave this alone. I've got some options that I've tried and have worked in the past, so I'm curious about others. So we'll pull together folks who are interested in talking, gather stories, gather comments, gather information. We'll see what we can come up with because, I've done 4 consults in the last month on this topic. And what we're noticing is people are now in less familiar settings. And when they're in their own bedroom, there might be more of a chance that they go to the bathroom because it's right there and it's visible from their bed. But when they're in a common area, no way. So we got work to do. So we're asking for help and we're hoping that you'll be able to do it. Now, women do on occasion do this as well, but it's definitely less common and they behave a little different. So thank you all for being willing to listen and give us some feedback because we're in this as a team. And I got several requests. And so I'm feeling like, wow, I bet this is a bigger issue than people are thinking it is. And I think what we tend to do is want to put it in the back closet rather than just say, well, if it's happening in the living room, let's talk about it, because I don't think it's on purpose. It's not like they used to do stuff like that. So I'm suspecting it has something to do with their brain change. So maybe we need to change something. And instead of trying to cover it up and make it go away, because it won't, we'll just cheat people out of some possibilities potentially and create relationships that aren't so great. So Matthew, thank you for your help because I know you were busy out there getting things set up for people to respond. Anything you want to add as we close it out?
Yeah, I put in the comments section. So Teepa threw this ask out. If you are willing to help us with this, if you've had experiences with this, and are willing to share
failures or successes, or just experiences.
Yeah, in any way, please reach out to us. And I put the email in, so it's the ata@teepasnow.com. Reach out to us on that email so we can connect with you and continue to explore this. And thank you so much. We really appreciate your help. Thank you to everybody who participated in the polls too, that I put up. We really appreciate that because the more information you guys are giving us, the more you're sharing with us, the more we can try to work on helping to support you all better out there.
Yeah. So thanks, everybody. Ooh, and Matthew and I'll be recording the session for tomorrow. It'll be Saturday. It'll be recorded. Sunday will be live. It'll be me and the boys. They're back from Michigan. And okay, here's the truth. The family is driving in. Friday evening, they're coming part way. And then Saturday morning, they're driving more. So they're going to drop them off just in time for our Saturday evening time together. And they're going to go home and go to sleep. It's what they said. I don't know if that's true or not, but I suspect after a long car trip, they may need that. And a great vacation, quote unquote. Though Amanda's been working, and I know Dan's been having a great time with his dad and family. So I'll see you Sunday. I'll see you tomorrow, but yeah, Matthew and I'll be ahead of time. All right, everybody, have a great day. Take care with care. And thanks for your help.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.